The phrase, not a cure-all, means that the thing being described does not provide a complete solution to all problems or does not fully address the issue at hand. The phrase, not a cure-all, implies that something, in this case, caffeine, does not provide a complete solution or remedy for a particular problem, in this case, sleep deprivation. In the context of the passage, when it says, improved alertness due to caffeine is not a cure-all for sleep deprivation, it means that while caffeine can enhance alertness, it does not completely solve or eliminate the negative effects of sleep deprivation. It's acknowledging that caffeine may offer temporary benefits, such as increased wakefulness and cognitive function. However, it doesn't address the root cause of the problem, which is the lack of sufficient sleep. Therefore, option C best aligns with the emphasized idea of the phrase, not a cure-all. It directly addresses the notion that while caffeine can improve alertness, it does not fully address or eliminate the consequences of sleep deprivation on the body. The idiom, silver bullet, refers to a single, perfect solution to a problem. In the context of type 2 diabetes management, the passage emphasizes that exercise alone is not the perfect solution. It highlights the need for a multi-pronged approach involving diet, exercise, and potentially medication for optimal management. This implies that focusing solely on exercise wouldn't be enough to effectively control blood sugar, just like a silver bullet wouldn't be enough to win a complex battle. Hence the answer is C. A combination of diet, exercise, and medication is most effective. The idiom, make a break for it, typically means to escape or run away abruptly. In the context of the passage, it's used figuratively. It doesn't literally mean surgeons should abandon their duties. Instead, it implies that robotic surgery is not a reason for surgeons to completely abandon their traditional skills and expertise. Even with the assistance of robots, human surgeons are still essential for successful outcomes. So the answer is C. They need to oversee the robotic system, make crucial decisions, and possess the surgical knowledge to navigate any complications that might arise. The idiom, walking a tightrope, refers to performing a difficult task that requires great focus and balance. In the context of the passage, it doesn't literally mean healthcare workers are physically walking a tightrope. Instead, it's used figuratively to describe the challenging situation they face. Healthcare professionals have a strong responsibility to provide excellent care for their patients. However, they also need to take care of themselves to avoid burnout and compassion fatigue, making D the correct option. The passage emphasizes the delicate balance they must maintain between these two important aspects. The idiom neck of the woods refers to a particular area or environment that someone is familiar with. In the context of the passage about the microbiome, it's used figuratively to describe the different niches within the human body where specific microbial communities thrive. The passage highlights that the gut is just one example of such a niche, with its own unique set of microbes. Researchers are interested in understanding the specific microbes that call these different necks of the woods home, suggesting these distinct locations within the body, making it the right option. The idiom pin down means to definitively identify or settle something. In the context of the passage, it refers to using information, likely from the internet, to conclusively determine what medical condition someone has. The passage argues against this approach. That is, in the passage, it's used to caution against relying solely on information found online to make a definitive diagnosis. While the internet can provide a wealth of health information, it may not always offer accurate or personalized advice. Therefore, the idiom emphasizes the importance of consulting a qualified healthcare professional for an accurate diagnosis and appropriate treatment plan. This ensures that medical conditions are properly identified and managed based on individual needs and circumstances. The rule of thumb is an informal principle or guideline that is based on practical experience or common sense rather than strict scientific or mathematical analysis. It's often used to provide a rough estimate or a general rule for making decisions or solving problems when precise measurements or calculations are not necessary or available. The passage emphasizes that while brushing your teeth twice a day with fluoride toothpaste is a well-known dental hygiene practice, relying solely on this practice may not be sufficient for optimal oral health. While brushing is important for removing plaque and bacteria from the surfaces of teeth, it may not reach areas between teeth where plaque can accumulate. Additionally, limiting sugary foods and drinks and regular dental checkups are also important components of maintaining oral health. Therefore, the limitation of the rule of thumb is that brushing alone does not prevent all cavities. See. This suggests that there are other factors involved in cavity prevention beyond simply brushing teeth, such as flossing, dietary considerations, and professional dental care. The idiom, saving grace, refers to something that makes a bad situation better, or something crucial that prevents something negative from happening. In this context, saving grace suggests that continuous learning is not just beneficial or desirable, but absolutely necessary for healthcare professionals to fulfill their responsibilities effectively. It implies that while the field of medicine is constantly evolving, ongoing education is the key factor that enables healthcare professionals to adapt to these changes and deliver the highest standard of care to their patients. Therefore, the idiom emphasizes the critical importance of continuous learning in the context of providing optimal patient care. Option C.